I'm Erica Garnes, some of you guys' program advisor, and I'm here with Andrew Madouty. This Learn Together session is obviously, I host these, but it is one of my favorites because you guys get to hear from an alum who was literally just in your shoes not too long ago. So I love these sessions because you get the opportunity to hear from them. You get the opportunity to answer any questions about the workforce that they're in. Also, specifically with Andrew, I think when you think about public health, you don't always think about finance. So it's going to be really interesting to hear from him. So it expands your knowledge of what your opportunities can be. So I'm really excited to chat with him. So thank you, Andrew, for joining us.
Thanks for having me.
We'll get right on ahead and get started. Can you tell us about the work that you're doing now, your role, your company, and how you found your position?
Yeah, absolutely. So thank you guys all for having me. My name is Andrew Madouty, as she's mentioned. So Erica has mentioned. My role at the moment, I work in 340B. 340B is a drug rebate program that is a government-regulated program, not government-funded, that is part of the Public Health Act of 1992, and 340B is actually the part of the Public Health Act that instituted this program for drug rebate for manufacturers and also for hospital systems and Ryan White clinics and everything of the sort. So basically what 340B is that it is a program that requires for pharmaceutical companies to provide us a discounted rate for drugs that we would provide to no cost to our patient population. So, for example, a monthly dosing of Truvada, which would typically be about like $8,000, and the numbers are made up. I'm just stating a very random number. We would be offered a very discounted rate, to which we would then offer to our patients at no fee, to which we would have in-house, and we would also have, there's an in-house component to it, along with a contract pharmacy component. So we would offer it to pharmacies that would offer our patients, specifically our drugs, at no rate to them.
Gotcha.
And I found my job on the NYP portal.
Love that. Okay. We'll get into a little bit of that too, how you got there. So how did your experience at NYU GPH, and just for, I mean, at this point, we all know that he was a global health student and graduated in 2018. But how did your experience at GPH help you get your job or prepare you for the success in the work that you're doing? Was it through faculty connection? Was it through an alumni referral, or just you just mentioned that it was through...
Yeah, through the NYP portal.
Okay.
But I think GPH does a great job at preparing us. I think that with global health, it allowed for me to have a lot more flexibility with what classes I wanted to do, and things might have changed since I've been here. But public health, global health at that time would allow for us to kind of like pick and choose things that we found really interesting. And one thing that I found interesting was the policy side. And I took a few policy courses. I took like a few courses that were outside of the realm of global health itself that helped me to get a full image of what I actually wanted to do. And I knew that I wanted to be in pop health, but I didn't understand what exactly I wanted to get out of it.
We actually still do that. Okay. As the global health advisor, we do allow for like the opportunity to have a variety of different electives. So they get to choose 5. I'm sure you had it roughly the same. But if there is a course or an elective outside of this list, I think there's about 26, 25 courses, they can go and find other opportunities and just get it pre-approved. So similar to what you did?
Very much so.
Okay. So this is a little random, little fun though, but just kind of starting off with understanding what one or two of your favorite or fun, meaningful memories at GPH was. It could be a class, it could be a professor, it could be a lab that you were in, or something you remember that was fun or, you know, meaningful, or something that you remember that you really liked about it.
Well, I was lucky at GPH where I got to do my capstone in Milan. And we were able to work in a clinic that was funded by a nun. And going there, we understood exactly what the clinic looked like, and we got a lot of background information. But just seeing it on actually in life and in real life, where you have a clinic that was offering meds and a full scope of clinical needs to refugees. So actually, I should revert back to talking about the clinic offered free healthcare to refugees because Italy, unfortunately, if you are not a citizen, they do not offer free healthcare. And the cost is quite costly for any sort of treatment, especially for long-term care. So the clinic that was Opera San Francisco, they basically offered a full scope of dentistry, OBGYN services, primary health care, along with a pharmacy right built into the clinic that offered their meds right as they were just leaving. Also, they had a food kitchen to which they were helping folks who were disadvantaged and unhomed to basically get 3 meals a day, but also offer them a shower. So twice a week they were able to go in, and they had a card system that they would allow for them to scan and be able to get a fresh batch of clothing, fresh shoes, and be able to recycle basically whatever folks were donating.
Okay.
So it had the healthcare component, but also had a more general pop health because everyone who's unhomed unfortunately needs that opportunity to get refreshed and to get food and to get things that they weren't being offered.
Yeah.
So it had the refugee component, but also the unhomed component.
And you did that as your internship?
That was part of my capstone.
Wow.
Yeah. So our capstone was working on mental health outcomes for refugee populations in Italy. Actually, one fun fact is that we thought going in there and we printed a bunch of brochures and translated guides and stuff, thinking it was a heavy Middle Eastern population because that was what we were told. But actually, we had a huge Latin America and Central America population that we had to retranslate on the night of all of our documents and reprint everything while in Italy because we didn't have it. We didn't think that we would get that population, but we did.
Wow.
So, very interesting.
Experience made you hustle a little bit?
Oh, yeah.
Prepare you for your role now?
Oh, yeah, for sure.
Okay, that's good. Okay, so specifically about the role and how you kind of got there from public health, or what people would see as the norm of public health jobs. Before we get into your exact role, how did you see finance managing in that?
I didn't.
Okay.
I fell into it. To which a lot of public health people will say, and a lot of alumni that I've met with, you are working in so many different fields, and public health is such a broad term that you just wouldn't really understand how you can be a public health official without having a public health title behind your name. So my job, for example, is a finance manager. I didn't go to school for accounting. If you ask me to do an accounting function, I might or might not be able to do it, but we'll learn, right? And that's something that as public health officials, nothing in our world is black and white, and just thrown into things that you make do and you kind of get to understand, right? As a finance manager, my role is a somewhat clinical role in the sense that we are reviewing charts and my team is reviewing patient encounters and making sure that the scripts that are going out are actually valid, and we want to make sure that it falls in line with what the government regulates for us. But we also have that financial component where we're doing Excel sheets. We're living in and breathing in Excel on a daily basis, having formulas doing the work for us. But it's very interesting because if you had asked me when I was graduating from CGPH if I would be in finance, I would be like, that doesn't make sense to me. But it's something that you learn and you become a part of, right?
Right. So kind of like expanding on your specific role, what does your everyday kind of look like for you as like manager?
It varies. But my role specifically looks at more of the in-house component to 340B. So I'm looking at pharmacy spend, looking to see where we're buying our meds from, how are we buying the meds. With 340B, there are multiple account types that you have to have in order to qualify your scripts. I'm also looking at the just patient encounters to make sure that patients that are receiving our meds are qualified and do they fit the qualification filters. If anything needs to be fixed on the system side, then we have to fix it. So I like to say in 340B, it gives you the component of having the clinical side where you're in a pharmacy and you're embedded in pharmacy encounters, spend, and all of that. But you're also embedded in the patient encounter side. You're looking at that. You're looking at patient status to decipher whether or not it would qualify for the parameters of 340B. But then you also have multiple facets where we had a new EMR go live. So you're also involved in that because you want to make sure that the system fits the needs of your program. So like you have IT, you have pharmacy, you have finance, you have so many different departments, all that you're working with. The cross collaboration I love it because you get exposure to everyone.
Right. Okay, so speaking of cross collaboration, how do public health skills that you got, even from your experience that you had before this role, but specifically at GPH, how do those skills translate into finance and operations within the larger scale of the hospital?
It's an interesting question because it's kind of similar to what I mentioned earlier. You just have to have that drive to understand that what you do is not going to be black and white, and
Gotcha.
you are basing your work and your workflows off of the work of many others.
Mm.
So as a public health official, your work is not only with physicians or with nursing staff. There are multiple people in bigger public health spheres that you have to gain the experience from.
Gotcha.
So working with them and also understanding their needs and understanding what their workflows look like in order for you to take back the work and to build on what you need to, and especially for what you're working on. I think that answers the question.
Yeah. It was more so of kind of again of how what you had learned, your experience, but here at GPH kind of got you to that, but just,
I think it's just a cross collaboration too.
Yeah.
Like, if as a student here, you're encountering people from all different departments, right? You have folks that are focusing on epidemiology, folks on biostats. You are building those connections because it's all about the collaboration that you build here too, where like people that were in public health policy. I wasn't a policy student,
Right.
but I would see their work and ask them questions, and I still talk to many of them.
Yeah.
What kind of work are you guys doing? What podcasts are you listening to? What source of public health media are you using? Because that all helps me and also helps them because that's what they're basing it off of.
Right.
And who drives policy? Who knows policy podcasts more than a policy student? They live and breathe it.
Right.
So that type of collaboration is what I
Okay.
gained from CGPH, and just being able to ask questions.
Yeah. Gotcha. Okay, so kind of again honing on skills. I feel like lately a lot of conversations that we've been having as advisors, but also with students, is kind of about soft skills and the basics. Outside of communication, because I feel like that's a lot, but it's important. What technical or soft skills do you use in your current role that you think students should develop? It can be within this role, or maybe because you manage people, maybe there are things that you've noticed about them that they could improve on as well. But just for students to kind of have an idea of what to work on.
Soft skills wise, I'd say taking risks doesn't hurt, right?
Yeah.
So if I'm assigning you something as a manager or as someone that's giving you something that we're working on together, yes, you can admit that you don't know it, and you should, because why take the chance to mess something up or to potentially do something and it be incorrect? But also sometimes you should do it so that you can determine based off of what is the necessity, or like what is the end goal, and are you able to have some wiggle room? If there's enough wiggle room that I can make a mistake and learn from it, then try and fail rather than not try at all. But then sometimes you also have to prioritize it because it is due tomorrow. Admit it. I don't know how to do this, or like, can you give me some guidance on it? Those type of skills are not hard to come by. Like, it's just talk to the person, and it all leads back to communication at the end of the day, right?
I know.
And it's just sometimes you have to take an Excel course. Maybe an Excel course can be a YouTube video to figure out what you are doing. We have so many AI components to the workflow today.
Yeah.
Testing, I don't say we trust AI completely, but maybe trust multiple facets of AI. Run it through Genesis, run it through ChatGPT, and see what the outcome is that you can potentially pull from it.
Yeah, I like that. Kind of goes into conversations that I've had with a lot of my alum in the past, is just taking the risk on yourself, like outside of just getting a job for a job, but like saying, okay, I might not think I fully qualify for this, but I have the knowledge, I have experience and somewhat of it, so I'm just going to try and do it.
Yeah. And there's managers out there that are willing to take that risk with you, right? That you might not have 100% what is required, or the required meets for that role. But if you were 100%, then you're just going to potentially just be bored within a day or two of working there. So most managers are looking for someone who they can teach and they want to teach, right? Not all managers are like that. I'm not going to say everyone is, but most people want to, because there's transferable knowledge that you can help to grow.
Right.
And you can help them to build their program. Because the more educated and more involved you become as an employee, the more you're able to build your program. And it's less of building the program, but more optimization, because you're finding ways to lessen the workload.
Right.
And focus on things that you want to.
Yeah. What's one lesson you learned early in your career that helps you today, but also for students to kind of know, be aware of, or even say, oh, I've kind of gone through something like that, or I've heard that before, or I don't want to go through that, so let me learn from somebody else?
Don't burn bridges. You never know where life takes you. And as big as the world is, it's still very small at the same time.
Yeah.
And the one thing that I will say is that don't be afraid of someone's title. As I mentioned earlier, everyone has gotten to where they are today because of guidance, and mentorship helps, and not always being directly under someone's mentor, like as a mentee to someone, as a mentee to someone, but you can see their trajectory. Like, you can reach out to someone if you are curious about it's. You don't always have to have an interview. You can have an informal interview too, and that's just a conversation. That's coffee. So many times I will walk and talk with someone, but that's because we're getting out of the workplace, but it's also allowing for you to have a conversation that is a little bit more relaxed, and you're able to get a lot more out of the, like, a better outcome in a sense.
Yeah.
You know what I mean? It doesn't always have to be an email.
Yeah, I like that. Also, kind of adding to that, we just had the Career Expo. Yeah, okay, yes, so hopefully you guys attended. Where it gave students the opportunity to just chat, have a conversation. You never know where a simple, handing your resume and asking this employee about a possible job could get you. And maybe not today, but like few years down, you never know. So I also love the Career Expo events for that, because you got to believe in yourself and put your best foot forward, but talk, communicate, get their information, get their email, be put on their email list as well, because you never know.
And LinkedIn. Yeah. LinkedIn is our social media for career path, right? And just because, as you mentioned, you can meet someone today, but 10 years down the line, they have a role open and they're like, oh, I met that person. Yeah, you can connect with them again, because you just say, oh, I met them. This is what they did. This was their name. LinkedIn. It's the easiest way to connect with someone. There's also a face that you can remember, because they're constantly showing up on your feed.
Yeah.
And just having a good LinkedIn profile presence helps.
Very true. Very true. Got to work on mine. So, yes, very true.
Headshots.
Yes.
There was 3 headshots. It could be a very informal headshot.
Yeah.
Because I will remember a face, I won't remember the name.
That's very true.
That was something taught to me at CGPH.
Okay.
That was the professor told us that. I will remember your face, I'll never remember your name. And if you need me, that's how, if you're reaching out to me, I'll have a reference.
Yeah, I like that. Okay, so just a quick chat about your past experience. I'm sure you all read Andrew's bio, but as the chair of Emerging Leadership Council, what advice would you give for current students who want to grow into leadership roles?
So the Emerging Leadership Council, I'll talk about that first, is a group within the organization. We have a vast hospital system. So the Emerging Leadership Council is basically folks that opt in to become a part of a council that helps them to grow. We're connecting you with leaders, we're connecting you with campus tours, we're doing a bunch to help broaden your horizon of just not your day in and day out job. Also helps you to network, because networking helps greatly. And your question, is about how does that help? Yeah, how did that help with your current leadership role? So that helped me, and what I liked about it was that you're connecting directly with senior leadership. Mm-hmm. People with a lot of titles, people with very high titles, and what that helps to do is that you become less afraid. Like if you are meeting a leader, you're in this other sphere outside of your day in and day out job where they see that you're motivated If there's special projects, as I mentioned before, that you've spoken to them, or they remember certain aspects of something that you do, and there's something new that they're trying to roll out, or something new that a new role they've taken at the institution, they are able to build a new team, they'll remember that.
Yeah.
And you can help to stay connected with them. Also, having a face in front of a senior leader also helps, because you're building that connection. It's similar to just finding a new job where, hey, I'm putting myself out there. These are the skills that I have. And I'm showing motivation. I want to be still involved. This is another way to do it.
Right. So a little bit of advice for students. How did your mentors or professional network influence your career? What strategies do you recommend for students that are looking to build that meaningful connection? And that can be here at GPH, or that can be outside or afterwards. You mentioned LinkedIn, kind of having that connection. But if you can talk about, one, how your experience was with mentors you may have had, and then like how students can go out, look for it, and like kind of create that.
So one thing that I did learn early on, a mentor to you doesn't always have to be someone in a high title. It can be a peer, because peers also are people who are skilled in their skill set that you can really learn from. And I did mention with the ELC becoming like a face to senior leadership, but there's certain components to what falls under a senior leader's profile or portfolio that those people report to them, but the day ins and day outs of those tasks, they don't work in, right? Because they don't have to do the nitty gritties, right? But a peer can help you to get that. If you are looking for a skill set and you're looking to enhance your own skill sets, working with folks that are on your same level or below or a little bit higher than you can help you. So that a mentor doesn't always have to be someone who is in a higher position than you. That's one. Two, mentors can be formal and informal. It can be someone who is in a community versus someone who works directly with you or above you or in the same scope of your work, because there's so many different things to learn. In Upper San Francisco, in my capstone, for example, we were in another country learning their component to healthcare. How were they functioning? We came from American healthcare, where you have a CVS around the corner. You can go pick up your meds as soon as it comes out, or the same place, you'll get a sample or something of the sort, right? This is something totally different. We're seeing a different scope of healthcare. Prior to being in, and I know this segues off a little bit from your initial question, we worked in Honduras. I did a medical mission in Honduras where we were working in a elementary school that we converted into a clinic for a week. That was interesting because the mentors that we had there were the actual military guys that were showing us a different component to how they function as a medic response, as opposed to what we were doing there as like setting up a clinic in a school, right? Mm-hmm. But mentorship comes in many different forms, and I think depending on the relationship you form with those individuals is how you would act on it. Informal meetings, formal meetings, Zoom meetings, coffee dates, figuring it out that way. Whatever works for you and that mentor, just get something out of it. And keeping in touch, not when you need something. Do not reach out to someone, hey, I need a job. Do you have anything? Or do you know of this, right? Building connections, sustaining them. A simple Happy New Year goes a long way. Yeah. A simple Happy Holidays or something of the sort, Happy Birthday. Not saying to get that informal, but if you do, then it's something that you remember, because that's something that you're involved in someone's life, whether it's annually, every 2 years, every 5 years. A simple check-in doesn't hurt.
I like that. And also going back to, like you said, you never know, right?
Also keeps you genuine.
Yeah. Yeah. And then all of our students, we all have faculty mentors. So I'm not sure if you guys have reached out to yours, but you do have them who are there that could be your mentor. You know, that's what they're there for. So I'm not sure I don't know if it was set up the same way.
Yeah, I have a mentor.
No, when you were here, okay, well, great. Did you?
We still keep in touch every so often, yeah.
I love it. That's what I was trying to get out there.
Yeah.
That's great.
Good.
Okay, so for many students who feel pressured to have their career path figured out now, because this is the generation of now, how did you navigate through that uncertainty of, I know you said like it just happened. You didn't know, but it just happened. But kind of how did you navigate with that uncertainty, and what helped you stay confident within your journey? And even if you weren't confident, what helped you stay focused for it?
focused in this is always going to be there. You just have to stay determined. You got to have a job. You got to grow. And you look for the next best, right? And the next best is something to put on your resume that is going to enhance your career experiences for the future, but also for the current state. And you want to finding a job is hard. I won't say that's easy, but finding a career path is even harder because you want there to be a stepping stone. You want to show a ladder in your growth, right? And you just want to continue to learn because the more you learn is the bigger your like portfolio will be as you continue to move up to higher positions. And I will say that confidence, it comes and goes.
Yeah.
You always, in any job, and I don't know, imposter syndrome will always be there. Do I really know this? Is this really what I fall? Like, does it really fall under my scope? Can I do this? But you can. And you can because you can enable yourself to learn from others. And accepting that, hey, I don't know this enough, whether you are learning from someone else or you're going home and actually taking the time to study.
Yeah.
Because working comes with studying because you have to learn. It's an ever-changing world around us. Yeah. We have to understand how AI can potentially take these tasks from us or better our workload because we want to be able to enhance and optimize.
Yeah. Last Learn Together we had with Sarah Christ. Yes, sorry, always mess up her last name. She mentioned that she still uses like her material from GPH, her epi book, as like a reminder of always like kind of going back to be like, you know what, I'm skilled in my job, but you know, I'm never too good to open the book and still remind myself of the material. So I think just taking a second to go back and think about that, always needed. I want to ask you a quick question about your challenges within your current role. What are the biggest challenges currently that you are seeing with the 340B programs, and how do you navigate through them, like tough times or?
Well, 340B is government related. I'm not going to get into politics,
no,
but it is government related. So whether it's this administration, another administration, you always have to stay up to date. And being up to date is following through, as I mentioned, podcasting, keeping up to date with the news, forums, everything of the sort. You just have to stay involved and informed. And I think that is very important. And I hope to say this, and I probably shouldn't say it, but public health students, we love Reddit. We love talking to each other, and we love being able to like voice our opinions in kind of like an anonymous way, where you're able to say, "Hey, how do you do this?" or "What are you guys dealing with?" And like, not saying Reddit is the only forum, but there are also multiple different ways to voice your opinions, and there's social media outlets today that can help people to, and there's podcasts and so many things that people are doing that helps you to stay informed. And yeah, the question goes back with like challenges, and I think that being in 340B, you just have to stay informed as to what's going on. So whether it's a government relations team that you're relying on to help you understand whatever new policies that are coming through or anything that's changing, but also just like taking your own time to look up and see what's going on.
Yeah, very well. Okay, so as we come to a slow wrapping, I want to know what keeps you motivated in your work, especially when dealing with complex situations and the things that are happening right now, the current situations that we're in. But sometimes it can be difficult to, right, go through the challenges that are happening in the public health field. But what keeps you motivated, and what advice would you have for students?
Everything that you do is affecting a patient's life. And you might not have to be in healthcare directly. You might not be in hospital care. Everything that you do has an outcome that is helping someone. And your bigger goal, and you're sitting here today in NCGPH, and you're working for public health. You're working towards becoming in the public health field because you want to have a better outcome for folks. So any little thing that you do is helping someone. A former senior leader, not at the current hospital that I'm at, but I'm pretty sure they would say the same thing. Everyone in a hospital, whether you are a custodian, whether you are a physician, whether you are a nurse, whether you are a dietitian, whether you are someone working in the kitchen, everything that you do on a daily is affecting someone. Similarly, in public health, if you're working in policy, you're helping someone. If you're doing bench research, you're helping someone. You might not feel it. You might not see it day to day in like an instantaneous outcome, But what you're doing behind the scenes and what you're doing in the front of the scenes, whatever role you're filling, you are helping someone. Just remember that. And that's something that we are all here. We're pushing through. We're trying to like stay strong with, and yeah, just take pride in that.
Yeah.
That's something to build your own confidence.
You mentioned it before that, the public health field is ever changing, so I think knowing that and staying within it is really important to know, and finding whatever drive. Like I mentioned, these are one of my favorite events because you get to see or hear someone start to where they're at now. And maybe their start wasn't the current, situations that we're in now, but, they're growing, they're learning, and they're striving through it. So thank you very much, Andrew, for sharing your journey. Does anyone have any questions? Yes.
Yes, I have a question about in your experience, like recently or even like the past 2-3 years, when like someone new comes onto the team, where like you find a new coworker, I guess like what like in the like I don't know if you've been involved in the hire process at all, but like what are the like things that you like see in people that you think you say I want to work with someone, or like someone who's new or like onboarding onto the team and you're like, yes, this was the right choice. I'm happy that this person's not working with us.
Keep an open mind will definitely helps, right? Because some people, everyone responds differently to a new job and a new role, and depends on, you just have to trust that the person you have hired is a good fit. And you just have to be able to say, well, this is a skill set. And as I mentioned earlier, everyone's not going to be at 99% when you hire them. You want to help them grow. So you as a hiring manager, I think the question is more of a hiring manager perspective, or I'm trying to understand. Sorry, take me back.
I'm more asking because like obviously like the competitiveness of the current job market, I'm kind of trying to get the perspective of like from the people that like who are actually deciding whether or not to get to work with them, like what traits are they looking for that like makes them think I'm like this is someone I want to work with.
Oh, being open for sure, and being open to any sort of like, I will say, just tasks. So if we're assigning you something, take it, run with it, see how far you can get, and just being willing to understand and tell. No one's hiring you just to like see you fail. Everyone who's hiring you wants to see you grow. So admitting that if you know something, you know it really well, then run with it. Take it under your belt. Whoever is hiring you would love to see you grow and to utilize your skill set to enhance that experience. But then on the flip side, if you don't know it, then let us know. We want to help you grow. We want to get our team, because we hired you, we want to build that team. We want to build that camaraderie, and we also want to help you to get that skill set that you need to make sure that, one, your work is valid, and two, that whatever we are teaching to you will help enhance your experience. Because if we're not doing that, we're not doing it right by you.
Right. Yeah, it's kind of even going back to how you said that you didn't know that you were going to be into finance, and kind of how you found it. You had to be open enough to say, okay, I may not know how to do this task right here today, but I can get to where I need to get to. And if someone believes in me to do the work, then I can do it.
Yeah.
Hi, thank you for speaking with us today. It's very informative and reassuring to know that there are people higher up in the profession that still believe in the younger generation and leadership and whatnot. I was curious if coming out of GPH, you had a job lined up right away, or did you kind of take some time to either do some fellowships or other internships before you stepped into the corporate world?
So I was a little different when I was in CGPH. I was working full-time already. I was working full-time at Sloan Kettering at the time. So that role was much different than what I do today. But after leaving GPH, I was able to apply and utilize my skills that I learned here and also in undergrad and such to develop my role in 340B and to apply for that and feel confident and compelled to do that. But I did work. I didn't do a fellowship. I was working compensation oncology at the time at Sloan Kettering. So, yeah, I didn't have a fellowship. I know a lot of people were doing internships. I didn't do an internship. Sorry. Okay. So I'm not a good representation of that. I won't lie.
Yeah, but you did have experience with in Honduras, and you mentioned that you were also.
I did undergrad in
Capstone. That's what it was.
Yeah, I did undergrad at Hunter College, and yeah, I just did a lot of I was always in healthcare. I was always in the hospital setting. throughout my entire 17 years onwards.
Just quick question for you. Are you feeling a little pressure there? You're going to graduate in this May, right?
No, I'm a first year student.
Okay, good. But I mean, that's a good question because it's a very real question, regardless if you're a first year or you're graduating this spring. Because I think not everybody has that experience of being or currently having a job and then not having something to automatically land on once you come out. But very real. So use all the advice that Andrew gave, your advisor gives you.
Intern.
Yeah.
Intern. Take all the internships as you can.
Yep.
Because not all of them, but like whatever works for you and whatever you find interesting, right? Because you never know where that hiring manager is going to take your career in the future. Let's say they have a position that opens after you graduate, or if they themselves move into another role and they're like, oh, that intern, that was great.
Yeah.
So stay connected with them.
Yeah.
Just build bridges.
Yeah.
I think my background is kind of similar in the sense that I already have more than 10 years of working experiences in the healthcare industry and decided to pursue my MPH. And two questions for you. First question is, why did you decide to pursue MPH and in particular in global health?
I knew that I always wanted to do something in pop health. I knew that bedside was great. Bedside medicine is great, and it's just not something that I personally wanted because I felt too empathetic. I would take my work home. I'd be the person drowning just because I knew that I would always be thinking about the bedside component to it versus like something more pop health. So I knew I wanted to do something that was affecting more folks but less involved in the bedside medicine component. That's why I chose much to do my MPH and global healthcare, just because I like the global component. I think that there's so much to learn across all countries about what their healthcare systems look like and how can we grow and how can we change ourselves. Or like, I also thought it was interesting. Like I went to med school in the Caribbean, right? So like the healthcare that we learned in the Caribbean is much different than the healthcare that we learn today in the US. And I kind of nerd out on that. Yeah. So that's why I chose global health. Yeah.
Quickly, my second question is about, I really like your answer, how you keep your motivation. Everything you do is for the patients.
Yeah.
And I used to work for a pharmaceutical company, and that's exactly what we always say. And if possible, could you share with us maybe one or two stories where you really felt that you're adding value to patients?
Okay.
I'll talk about my capstone, actually. So we had a patient come in, Urdu speaking, to the clinic in Milan. It's very infrequent that we got someone of South Asian descent that was at the clinic. So it was a younger, I'd say he was about 17 years old, came in, didn't really speak any Italian, but also was struggling with English. But then I realized, oh wait, you actually speak my language, so I can speak to you. So we were talking and just like, he was so young, came through a difficult pathway to land in Italy, and his journey was quite an airful. And just talking to him and letting him express his emotions to someone who understood him was basically, he came for a checkup, yes, but the emotional component to what he just dispelled, or he just talked about what he went through, it was more helpful, I will say, because he had a clean bill of health at the end of the day. But it was just like incredible to hear his journey, but also to just be an ear to someone who just needed a voice, to be able to speak to someone, be understood, to feel empowered, to, you will be able to survive. You will be able to make it. However you do, we wish you all the best, because there's only so much that we can follow up within the time that we're there. But just being able to be there for someone, I think that was one thing that really helped me, because it was like, I didn't help you with anything that you needed clinically. I just was sitting there listening to you.
Sounds like the connection itself is the impactful
and that was so helpful to him. To just see him walk out of the clinic with actually a smile on his face, despite all that we just talked about that was so burdensome on him. But just having that experience was great.
Yeah.
I'd say it was one. Yeah.
And I'm sure you've also had experiences like that yourself too, where you've connected with a patient or had some,
I do. Well, as an employee at a pharmaceutical company, outside of the US, we don't necessarily have direct access to patients because it is kind of regulated. But through physicians, we heard like feedback that medicine, well, my ex-employer is providing was really helpful, or they say like we provide lots of tools, and then these tools really help them to accelerate their diagnosis to for the designated populations of patients, and that work was really powerful. And more than any kind of compliment from my manager, I thought this is what I'm working for.
Yeah, feels great.
Yeah.
Definitely feels great.
It's a little corny to say, but I'm sure we've all heard that having a job that you really like is like the real goal in life. Like that's the real thing that also not working would be great too, right? But a job that like you're excited for every day because you feel that connection, whether it's helping people, whether it's just you're just happy to do the work. But specifically, like Andrew mentioned, and obviously in the public health field, it's not about us, it's about the patients, right? So just having something where you, not just the role, but you yourself wake up every day and they're like, I'm happy to help, happy to be here, and I love what I do to be able to help others. Good. A little corny, but it's good.
Mm-hmm.
Thank you so much, Andrew.
Thank you for having me.
Really appreciate that you came and spoke to everyone. I found this really helpful. I hope you guys did as well. And if you guys have LinkedIn and Andrew is willing to share, if you guys would like to communicate to him afterwards, that'd be great. But thank you so much.
Out.
All right.